Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Why is learning CPR important?
In the United States, cardiac arrests are a leading cause of death in our community. And most of these arrests actually happen in people's homes. So the person that's there with them in the home, like the partner or the spouse or the relative, are really the people that are going to provide the first CPR efforts to resuscitate the patient. So it's really critical that the public knows how to do CPR. And there's a campaign by the American Heart Association to really teach people Hands Only CPR. Because when people suffer a witness cardiac arrest and you see that person go down, pass out, hit the floor, they actually still have oxygenated blood in their body. So if you can move that blood to the vital organs by doing CPR, you can make huge improvements in their outcomes.
You come upon someone who is passed out on the floor. What are the first steps you take?
What we recommend is that they call 911 immediately. And if they can, put their phone on speakerphone by their side, because the 911 operator is going to want to get information from them. But at the same time, they want to approach the patient and start CPR. And so we recommend putting the hands in the center of the chest, pushing hard and fast, about 100 times a minute, and just keep doing that until help arrives. If you need to take turns with a family member because you're fatigued, that's perfectly reasonable, but you just don't want to interrupt the CPR. And at this point, we don't recommend breaths. Obviously, if people are trained to give breaths, in a child, in a drowning, there's certain situations where breathing is very important. But in the standard cardiac arrest that's witnessed at home, hands-only CPR is very important.
What does the data say about those who lived after having CPR performed on them versus those that don't?
Just roughly, immediate CPR can even double or triple a person's chance of survival versus no CPR.
Can you go over the steps taken for CPR?
You don't want to waste time checking their pulse or asking if they're okay. If they look like they've collapsed, you should start CPR. Then you want to put your hands in the center of the chest and push hard and fast. We often say, think of the song Staying Alive, because that's sort of the tempo and the pace you want to keep up. And it's about 100 to 120 compressions per minute. And it's important to go deep with the compressions, because you're really trying to pump the oxygenated blood throughout the body, particularly to the brain.
Should there be a fear of hurting a patient when performing CPR?
I think a lot of people are scared to do something because they're scared they're going to cause harm. And I think the important thing to remember is if someone suffered a cardiac arrest, you can only help them. They're essentially dead at the time of the arrest, and whatever you're going to do to them, it can only help them. So I've had patients where I've done CPR and I've cracked a rib, and they've thanked me because although they have pain, they survived their arrest. So you really can't hurt someone by doing CPR.